Oops, is my microphone? Oh, it is on. Thank you. I apologize for being late. Traffic was what traffic was. We'll stand for the Pledge of Allegiance, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Mr. Pratt, can we certify the agenda?
Good afternoon, Board of Health members. Chris Pratt with the County Attorney's Office. Our office has reviewed all of the items on today's agenda and they meet legal approval.
Thank you. Are there any member disclosures for items on this agenda? Okay, great. Well, first I'd like to welcome Kevin Bracken and Catherine Willie. I knew that. To serving as alternates, respectively, for Commissioner Teal and for Commissioner Thomas. They are old hands at this, though, having served on the advisory task force, and so they are well prepared to fill in tonight. I want to open with a few comments before we move on to the consent agenda. First, I think we're all acknowledging at this point, I am anyway, and certainly this is open for discussion and debate, but that the pandemic is over, that we've moved on past the pandemic, and that we are now in a post-pandemic period in all of our lives. With that being true, I plan on having a resolution drafted and working with Mr. Pratt, of course, put it in the proper format to at least suspend the public health order that we have in place right now. I think if we're not in a pandemic, we don't need a public health order respecting the pandemic, is my view. Though there may be folks who want to think this through, and there may be differences in that, but I think in the next meeting, what I'd like to do is have on the agenda a suspension of the public health order. I say suspension because there may be some, we don't know what's going to happen, and there may be a need at some point, hopefully not in the near future, for a public health order to be reissued. And I want to talk through the options that could be available to the Board of Health and to our new director, Michael Hill, to act quickly in the event that there were a need for a public health order, and to examine whether there are potentially some options where he could declare a public health order for a short period of time pending board approval in a very timely manner. So at the next meeting, I will be proposing that we rescind the public health order. We're not in a pandemic, as I said. We don't need a public health order. Let's move on. Second, and I've had discussions with both with Director Hill, but both Commissioner Thomas and Commissioner Teal about the possibility, and I've also talked to the county manager about the advisability, and I think it is advised, but again, this is something that will be up for discussion. The advisability of doing sort of an after-action review of the pandemic response at the county level to determine what went well and what could be improved. This would obviously, require us to look at the advice that we received from the state, would require us to look at how we operated, would require us to take a hard look at the operations, I think, of county government, working with a broad array of stakeholders to determine what we would do differently in a future pandemic, and what we want to preserve so that we may not be here in the event there is a future pandemic. Somebody has something in their hands that they can look at. I've said this before. I was at EPA when the pandemic broke out, and I was responsible for managing our responses. I used to tell employees when I did a lot of employees meeting, that EPA has 14,000 employees. I used to tell them there's no handbook for this. So we're doing the best we can with the information that we have, but we don't have a manual for it. So we're going to make mistakes. When we know we're making a mistake, we'll we'll revise course, we'll acknowledge the mistake, and we'll learn from it, and we'll move on. What I'd like to do is take a look and be able to leave something for people in the future so that they can't say, or they won't be in the position of saying, we don't have a manual for this. They'll have our experience from this. And if it's us who are sitting here, then we'll have a document to turn to that will refresh our recollection of what went well and what could be improved. And I would view this as being a broad look at a broad review of the county's response. And I think there are a bunch of stakeholders that we'd need to work with. I think we would have to most likely hire a consultant to help us walk through this. This isn't something I think that we could just ask county staff to do. I think we need a third-party consultant to come in and do it. So, and I don't believe this needs a vote, but I've talked to county manager, the board, and Director Hill about this already. I'd like to direct them. And this, let me make one other point that's very important. We'd be doing this, but I think the ultimate decision-making authority would rest with the county commissioners. I think we would be advising them on how to move forward. This is probably broader than just the Board of Health, though this is probably a good place for us to start it. So with that being said, I'd like to direct Director Hill and the county manager, the board, get together, discuss what an outline would look like. I certainly have thoughts and will be willing to put those thoughts in writing and provide them to you. And let's start fleshing out a path forward so that we can do a pandemic after action review for the purposes of, again, capturing successes and capturing opportunities for improvement. With that, let me stop there because I've said a bunch. Let me open it up, see if anybody has any comments. Councilman Bracken.
Yeah, thank you. So I think that during this process, interpreting the Tri-County Health Department's actions, data, and information is going to be key, because that's what essentially during the pandemic, the information until a given time, until the Board of Health was organized, that it was cascaded down from Tri-County Health. So I think what will essentially be evaluated would be the state, the Tri-County actions until the time when the Board of Health was formed, and the actions that were taken. So we're really retrospectively looking back at Tri-County's actions and how they affected our county throughout the pandemic. So does that seem like a fair summary?
No, I think it's a fair partial summary. What I don't want to do is I don't want to put a target on anybody's back and say we're going to be looking at exclusively your actions. Tri-County certainly was involved, and we'd certainly look at, how that operated. Though Tri-County gets guidance from the state of Colorado, and frankly, the state of Colorado gets guidance from the Centers for Disease Control. What I'm sensitive to turning this into is an exercise where people believe we're looking to provide. We're looking to. Yeah, we're looking. Yeah, I was trying to find a better way to say it, but that's definitely not what we're trying to do. What we're trying to do is provide a fair assessment of what happened, and again, what would people in our I know what I would want to know if we went through this again. We hopefully we've got a lot of that now. What if somebody else is in this position 10 years from now, what would they want to know? We kind of have that now. Let's write it down so they're not calling us up and saying, hey, you remember? It's kind of like, Y2K, we don't want to have to look back in a long way when people are calling us and saying, what did you do? What we want to be able to do is have it down in writing in a fair assessment, in a neutral assessment, and say, this is what you need to know. Yes.
And
Doctor.
I agree with you about that. But what I would say is a timeline would be very, very useful on this as to when the information came through,
Right.
from who, what was the most useful in, say, our hospitals, what was the chain of command on that, how it filtered through, how we changed it. But absolutely a timeline and a look at the data we're receiving from the state and their modeling team and how we changed that over time. Because they did change the assessments over time, so which was the most accurate? Not in any type of we're not going to condemn anybody, but this is a learning experience and a very unique situation. And over that period of time, as this evolved in 2 years, we learned a lot. And I would like to be, if something like this happens again, to know what's the most important data for us, what's the most important indicators, what basically worked. And so this is an excellent idea to have a manual for the future. Who you contact, what the chain of command is, what actually works.
Right. Exactly. That's exactly right. And I think that's what you were getting at too, Councilman.
I'm saying retrospective look at what's happened, and the managing body, we're going to be interpreting their information, was kind of my point of what the decisions were made. Until then, we obviously know what decisions were made by the Board of Health, because we all participated in that, and perhaps even document that as well as part of the report out. But the greater discussion was looking at what's happened, and I think Dr. Fielding summarized it well.
And it's got to be a broad stakeholder, broad stakeholder group working on this and working with, assuming we move forward. Again, right now we're in the initial stages, working on this, because there's a whole lot of stakeholders out there that were involved in this from the county perspective. And we need to make sure that everybody probably has one piece of information that is unique, at least one piece of information that is unique to them. Let's get that. Let's find out what they learned through this process, and then let's go ahead and let's capture that. And I think I just feel very strongly this is really important, because at the end, we're all going to walk away. Knowledge will be lost, and that will be a shame. Yes.
I would also like to add that, everybody was learning.
Yeah.
This was unique. Everybody had a learning curve through this, and it was fairly steep, and it happened very rapidly. I think it's really important that we're looking at, they always say, look at the science, but there was so much science going on at a huge clip. More research going on than we've ever seen, very quickly. I think it's important that we capture not only what is the meaningful data, but what's the clinically relevant data for outcomes, and really be able to capture that. I mean, there were many missteps across the board, across the world. So for us to be able to capture what we saw here locally that impacts our own community is going to be key.
And there were a lot of good things that happened too.
Absolutely.
Public health workers on the front line ramped up really quickly in order to be able to handle what potentially could have been a mass event, how did they do that? I mean, we know, well, they did it. I guess we know how they do it. What did they learn during that really successful ramp up?
Agreed. And I think that I think everybody stepped up to the capacity that they could, and they did it very quickly and in an organized way in most cases. However, there were the missteps, and I agree we shouldn't be finger pointing. Mm-hmm. That's not the whole intent behind this, but to capture what our learnings are, the pluses, the deltas,
right,
and what we could learn.
Exactly.
Thank you.
Any other comments? So, Michael, you know what you're supposed to be doing, and we will we'll probably get updates on this as we move along. And that, I think we can put that one. We can move on now if there are no other comments. The next item is consent agenda. So it's really just approval of minutes. Has everybody had the opportunity to review the minutes? And are there any revisions to those minutes? I would seek a motion to approve the minutes.
I move to approve the minutes of our last meeting.
Do I have a second?
Second.
All in favor, say aye. Aye.
Aye.
Opposed? Okay. Now let's move on to the regular agenda. We have some information-only items, and we have one action item for this meeting. Director Hill, I will turn it over to you.
All right. Thank you, Mr. President, and I'll try and talk loudly this time and get people to hear me online, both of them. So again, I'm not going to read this report to you. You've got it. We're up to about 22 employees with a couple who are like pending hires that haven't actually showed up yet, but they're hired. So I'm counting them as the 22 employees. We took on environmental health as of September 1st. Great cooperation from the Tri-County staff and environmental health here. I mean, they were key to this, along with our staff and the state of Colorado staff who helped us get this together. So kudos to everybody who was involved in that. It was a big lift. And I'm saying right now, telling newspaper people that we are 85% done with building this health department as of right now, because environmental health was the biggest chunk. So that was a big month for us. So we've had a request before to put more reports into the agenda, so that's going to happen. That started to happen last month, but it was only reports, so we canceled. This time we got a little bit more meat on the bone besides just reports, but I do want you to start getting reports from all the managers and assistant directors. And I should probably introduce them because a couple are here that you probably haven't seen before. So sitting way back at the limit of my bifocal lenses is Caitlin Gappa, is Assistant Director for Environmental Health. Over here in the dark jacket is Steve Montanez, who's our Finance and Grants Manager. Next is Laura Larson, who is the Assistant Director for Community Health. And we have John Serbeck, who's the Manager for Emergency Preparedness and Response and Disease Surveillance. And with him is Elijah Knecht, one of our epidemiologists. I didn't miss anybody, I don't think. We got Bryn Turnby. You all know Bryn over there. We're still working on agreements. So WIC decided that we needed an agreement with Elbert County in order to be their WIC program. So we approved an agreement here and sent it over to Elbert County, and it went to their county attorneys and has not come forth again. So I have to dig that out. We also have to do an agreement with Arapahoe County because our county is not big enough to qualify for a breastfeeding peer counselor program. So Arapahoe County is going to act as our breastfeeding peer counselor program for Douglas and Elbert County. So I need an agreement with Arapahoe on that. And they indicated that they could originate that agreement and send it to me. And I also haven't received that back yet, so I've got to follow up with them. So a lot of little loose ends to tie up. A lot of work hiring people, training people. We are very close to announcing who our contractor is for the clinical services. They were getting ready to give us a proposal, a cost proposal, and we need that not just so we can start telling people who the contractor is, but so we can build the figure into our budget that they're going to ask for. And I think it's going to be a good deal for all involved, the way it was looking at our last meeting. We successfully applied for the Title V maternal and child health funding. It was a pre-application, but we were good on the pre-application, so the final application that's due at the end of the month, I'm assuming we're going to be awarded money for that. That'll cover like an employee. We're applying also for tobacco funding, which would cover a couple of health educators, and that looks pretty good too from talking to the CDPHE tobacco people. And we've got a public health nurse in the works who's going to be working for Human Services to do their home visiting program that Tri-County used to provide, but their nurse contract is going to end at the end of this month. So we kind of just made it under the wire of getting a new person on board for them. And I did have a request to put some COVID and monkeypox information into this report. So right now, COVID-19 is trending down nationally in Colorado and in Douglas County, pretty steadily downward. BA.5 is still the main variant that's out there. Today, I looked at the incidence, and it was 68 per 100,000 for the last 7 days in our county. And it changes every day, and whenever you look at the numbers, the number you quote is not necessarily the same one the other person looks at. So I don't want to be called back that it was actually 69, because it depends when you looked at the numbers. Monkeypox is also declining worldwide in the U.S. and in Colorado. We remain at a level of less than or equal to 3 cases. So that's gives you a pretty narrow range on what our number was. So monkeypox has not become a problem in our county. And I'm happy and willing to take any questions, and my staff are here not just to be shown off to you, but so you can ask them questions of their written reports if you see the need.
Yes, Ms. Willie.
So as I was reviewing the written report on page 10 of the packet, it said under EPR and Disease Surveillance Division update, it said work on close point of dispensing agreement continues. Lone Tree, Skyridge, and Cass Rock Adventist are in the works currently. Attached, please see a blank POD agreement. And due to the frequency of changes to the documents, staff is asking board to consider having Mr. Hill sign them. I just wanted to make sure that, have we addressed this, or does this need to be added as an action item for tonight's meeting?
My thought, unless the person sitting behind me or one of you thinks differently, that signing those agreements is probably already within my authority. So this is just out there to make sure that you know what kind of authority I'm granting to myself, and if you object, now is the time to object, or if it doesn't sound legal.
I would add that we follow the county policy, which allows directors, and we're treating the director of the Board of Health as a county director. They have the authority to sign an agreement that would obligate the county to $25,000 or less. So most of these agreements fall within that category, and so they would be considered within his authority, but it's still advisable for him to let you know they're there, and if you do have any objections, this would be the time to let him know.
Are there any other questions? Well, Mr. Bracken, Councilman, please.
Yeah, so the timeline to kind of round off the other 10% or whatever left over for staffing, is it, I mean, it seems like you've made some very good progress in Catherine and I and President Benevento were involved in the kind of the recommendation to the Board of Health. So very well done. But just out of curiosity, what are you thinking for the last handful of positions to be kind of fully up and complete?
So we're developing the job descriptions for all the remaining positions right now, and in a few minutes I hope to get permission to actually fill those positions. So that's the next step.
Sure.
But a lot of these programs, Tri-County plans on providing them through at least mid-December, if not the end of December. And also a couple of the programs, Tri-County has convinced the state that they can do that, so the state is not going to transfer the funding to us until January 1st. So we're in really good shape to bring on another, I forget how many people, losing my math skills this late in the day, to bring on the rest of the people by the end of the year. I feel real confident with that.
Okay.
Given the number that we brought on within the last month or two, it can be done.
Yeah, nicely done. Thank you.
Thank you. If there are no other questions, what I'm going to do is turn it over to you. We have some staff presentations, I think, and several are written, or they're all written.
I put them all in as written at this point, unless there's something really that we want to point out to you.
Okay.
But the staff are here, they put on their sport coats and everything, so feel free to ask them questions about those written reports. That's why they're here.
Well, they got all dressed up.
Yep.
So, my colleagues have any questions? Well, I have some questions that I can always ask. For Mr. Montanez? Oh, just so I assume you're working closely with the state on moving contracts and putting. How's the work going with the state?
Work is going quite well. Go ahead.
Oh,
Just
yeah.
so people online can hear.
Sorry?
It's so people online can hear. If you could cut, yes, please.
It's been a while since I've been in one of these rooms. Well, it's actually going quite well. Building and maintaining a strong relationship with the state in regards to the contracts and any of the grants that are moving over. Working very closely with local county as well in regards to the budget, which we're formulating as we speak. So everything's coming through and nicely, actually. I haven't had any hiccups as of yet. And if I have any questions, usually everybody's right there to answer any of those questions for me.
So it's kind of complicated because we have a Tri-County Health is going away and probably has shrunk now significantly. And so are they still providing services to us, or are we taken, have we taken all of the contracts that they have? The state fiscal year started a few months ago. How are we, where are we situated with respect to Tri-County? Is there any issue there with taking over any of the contracts that they have?
There hasn't been any issues thus far in regards to us taking over any of those, the transfers of the budgets the grants or the contracts. At this time, as they're being transferred or transitioned over to Douglas County, working very closely on learning the systems, on how we can actually manage them and just maintain them
Okay,
effectively and appropriately.
okay,
But no, we haven't had any issues.
okay. Thank you.
Oh, you're welcome.
Anybody else? Anybody? Okay, yep.
Okay.
Thank you very much. Mr. Surbeck, how's everything going? I know you put a jacket on, and so I wasn't going to let you get away with putting it on and not having to talk. How are we doing? How is disease? Disease surveillance is one of the more important aspects of running a local public health department, because we kind of tell everybody else what's going on and what we're seeing. Are we set up and are we ready to do that? How are we doing?
We're doing well.
Good.
We got some incredible folks. We've been working really hard to get a public presentation up with the dashboard to make sure that the information that we're getting is accurate so people can make informed decisions. We've taken over the investigations from Tri-County. The state has been wonderful to work with. Every time I get a chance to say something wonderful about our ladies in the epi world, I do, because people don't really understand. June 30th, we were nothing, and July 1, we were. And at the start of the day, we took over that body of work, and we did so with some constructive guidance and assistance from CDPHE, but there's quite a learning curve, and developing internal protocols and procedures and so forth. You can't do it without good people. We're extremely fortunate. Our lead epidemiologist is Ashley Richter. She was the person in charge of all things not COVID at Tri-County. So we got a great deal of institutional knowledge in that hiring of that person. And she's been really instrumental in helping teach and educate our other staff members who have a great deal of proficiency in COVID, but not the non-COVID body of work. So that is going quite well. We've just experienced a lot of growth, a lot of positive interaction with the community, developing we found some potential roadblocks because we never had a health department before. So working with some partners that didn't know they were partners. I know that doesn't make a lot of sense, but as it relates to animal control, peripheral elements that weren't engaged previously, and now they're needing to be engaged. So we're developing relationships. As Steve mentioned, it's all about relationships. So we do a lot of fence mending and fence building.
So, two follow-up questions real quick. So, one, and maybe building a little bit upon what you indicated with the rocky part, what's worrying you right now as we all do, lay awake in bed some nights thinking, gosh, this worries me. What's worrying you right now? Limit it, please, to the public health department. What's worrying you? What should we be aware of that could be a potential pitfall?
That's a great question. You're supposed to say that because it gives you time to think of an answer.
Right. I knew you didn't think it was a great
Yeah,
question. You were
yeah.
stalling for time.
Yeah. No, there are many things, and I really don't want to trouble you with
Okay.
the things that keep me up at night, but I think that we have good leadership. We have good community support. We have great people, and we approach things with a mission of stewardship, and that's how we shape our behavior. And so I think within that kind of funnel, we do the right thing. And so we encounter things every day that could be very bad, but we work through them in a very structured fashion with a very defined outcome, and they aren't that bad. If you don't let a lot of white noise get in the way and you stay focused on doing right by the people. And I think that's what keeps us going in the straight line, and knowing that we have this support, and Michael, they're all components of success.
School's back in session. How's that impacting your job?
It's just another one of those pieces. We have established a good rapport with the school district over the course of the last 2 years. They've had a great deal of turnover in key positions, so we're re-engaging in terms of going kind of back to build that foundation up again with the new players, working collaboratively to understand what the expectations of all of us are, how we can work seamlessly and lean forward to anticipate problems before they become problems, and to develop a unified approach to different situations that we encounter so that we don't find ourselves on different sides of the fence.
Okay. And everything, I assume, is going well with the hospitals. We're partnering with them in a productive manner. And
We are, as indicated in my report, we're working to develop the pod agreements. And we, on the other side of the house, on the EPR side of the house, not the EPI side of the house, we're involved in their emergency preparedness meetings and exercises and so forth. So, really getting that connectivity. And I give a shout out to Skyridge. What a great, incredible partner. And the municipalities are getting involved in those conversations as well. And you see a real commitment to community. That's what we're all trying to do is take care of people and do right by them, be good stewards, and demonstrate fiduciary. And it's quite refreshing.
excellent. Thank you. Thank you for your work too. You were carrying a heavy load for a long period of time. So
Well, I miss our Tuesday morning meetings.
thank you. Thank you.
Anything else?
Is any other questions? Ms. Wood?
I just want to take an opportunity that I know this much of what you do, actually, and thank you. Keep it simple. Thank you for all that you do.
Appreciate it. Thank you.
One last question, and Ms. Larson, I'm going to direct it to you, and I think you're the right person. But so, Director Hill and I met with the superintendent, of the schools, who's doing a great job, and she's really, she's got it. I've seen that job done up close, and it's just a massive undertaking, more so than people understand. And one of the things we talked to her about. I asked her if at some point she wouldn't be willing to come to the come to the Board of Health and talk about some of the disparities they're seeing in schools. Everybody says, and it's true that we're a blessed county. We're lucky. People do well here. We are a wealthy county. We're a healthy county. And I think that's generally a true statement. I think it's generally a true statement of Colorado. But there are pockets of disparity inside the county, pockets where people aren't doing so well, where you do have manifestation of diseases, or it could be mental health issues that are ongoing. That that's why we have public health, is to not focus on me and us because we're doing well, but focus on people who really need the assistance and need maybe some direction and help in getting that assistance. So I asked her to sort of think about the school district, look at the school district, and come to us and tell us what they're seeing. And then what I would like to do is maybe partner with the school district to see, okay, how can we help them? How can we help them address it? And I'm sure there's a lot going on, particularly in the mental health end. This county has been, out front, not just in the state, but nationally, in managing mental health issues and addressing mental health issues. But on any other issue that we may not be aware of exists. And I assume that would be something that would be falling into your bailiwick. And I'd be interested in your thoughts about, are we in a position, will we be in a position to sort of work with them and help address those disparities? Because again, I feel very strongly that's why you have public health, is to address, not to address people who are doing really well, but to address people that are maybe struggling and where there may be disparities, jumping in and addressing them. And would we be in a position to help out?
Absolutely. So it's interesting that you bring this up now. I actually just met with some members of the health and wellness team at the school district yesterday. And part of that conversation was really centered around substance misuse. We had a very engaging dialogue about how they're starting to see more issues even amongst sixth graders now, and especially in the middle schools, where prevention and education and awareness is really becoming a much more critical component of the work that needs to be done within our school district. So we did talk about that. We talked about broader mental health conditions and resiliency in our youth. We know that they've been impacted, especially across the course of the last 2 years, and really trying to come in with additional services and supports. And again, some of just the awareness and education piece that makes such a critical difference. If we can get to students and families on the front end of those issues, instead of coming in from a reactive standpoint, there's a lot more opportunity to create success with our youth. So those are things we've talked about. We talked a little bit about students that may have unique healthcare needs that are having difficulty accessing systems. We may be a wealthy county, we may be healthy, we're well educated, but that doesn't mean that the systems are easy to navigate. So how could we come in and help support that? So those conversations are already happening. We anticipate that that's part of the work that the Community Health Division will be doing long term. And it's really about, as the gentlemen before me have already spoken about, it's the relationship building and how do we create this really strong partnership, not just with the school district, but with other community partners, other county agencies, and really making sure that we're creating better access and reducing barriers to care.
Thank you. That's really encouraging to hear, because you're right. It's relationship building, and then it's targeting. It's okay. How do we target and provide access to services or access to information or whatever anybody else needs to those specific groups? And I think the school district is such a great place to start, because we're talking about children, we're talking about people who are vulnerable, and we should obviously serve everybody. But we have a school district that I've no doubt has an idea of what's happening, and if they look, they'll have a greater idea of what's happening. And I'd love to be able to have a very specific plan of working with them to address the health disparities that they see. And I'm really encouraged that you're already doing that. I should have known that you would be, though. So thank you. And anything that I can do to help on that, I was at the state of Colorado when we started our Office of Health Disparities, and to address this exact thing we always talked about ourselves being the healthiest state in the nation. Mm-hmm. But when you dug deep into the data, you find there were people that did need assistance, and our job was to then go help them. We want to maintain our status as healthiest county, healthiest state, but we certainly also want to pull everybody up as well.
Absolutely, and I think we're very, very fortunate because the community partners here in the county They are so enthusiastic about the community health services that we have coming down the pipeline, and they want to work with us. They want to make sure that we're creating access, and that's incredibly meaningful that we know we've already got that engagement on the front end, so that once January hits, we really have a good runway and a good foundation built to do exactly what you're talking about.
Super. That's great. Well, thank you for what you do. I appreciate it.
Absolutely. Thank you.
How's
Any
Michael
other
treating you?
questions?
Oh, no. Are there any questions from anybody? Councilman?
Nope. Well,
Oh, I thought you were going to ask a question. I was just going to ask, how's Michael treating you? But you can tell me later.
He's doing a great job.
He is doing a great job.
Thank
Any
you.
other colleagues?
you're going to let the epidemiologist off the hook?
Well, it sounds like Mr. Bracken may have a question for the epidemiologist.
No, just more of a comment. I met with several epidemiologists over the COVID timeframe, and some of the contact tracing policies and questions and some of their processes are, and God forbid if we ever go back to that same scenario, hopefully we never get back to that space, but that'd be something that I'd be really interested in at least being able to review through Michael's desk and through the epidemiology department to be able to make sure that we're hitting the target, because I felt that a lot of that the tracing activity was making major decisions on behalf of the Board of Health that was perhaps not the right questions or not the right data to be looked at. So a very important role for the future in tracking disease states and folks throughout our county. So hopefully we don't get back to there and you have a very uneventful interaction with me, but looking forward to your good work. Thank you.
Thank you all. Thank all of you for attending tonight. I appreciate it. So here's what I'm going to do. I'm not going to take public comment right now. I'm going to wait until the end on item 4 where we have citizen comments. I'm going to move into the action item. Director Hill, I'm going to ask you to go over and give a brief summary of the action item, and then we will take public comment on the action item, and then we will have board discussion, and then we will have a vote.
Okay, so this is hopefully the last request I come before you to ask for new people unless we get some fancy new grants in the coming years. And I've come to you, this is the third time asking to hire employees in tranches as I'm confident of the need for those employees and of the funding to pay for those employees. So this division is kind of the last one to come together, partly because of the delays with the state in getting the funding straightened out and the fact that Tri-County is holding on to these services till the end of the year. Mm-hmm. So I've worked with Laura, and we've kind of determined that what's presented to you on the far right of the org chart in a light orange, and PowerPoint tells me that is light orange, so it's not me saying it. I got in trouble with Commissioner Thomas one time for calling the colors wrong, but PowerPoint says that's light orange. All those positions that basically work under Laura, I'm asking to fill those not immediately, but as it becomes logical over the course of the rest of the year, just to get that permission behind me, and it will help the budget people who are listening in right now to understand what positions I'll have for next year's budget. So I can answer questions about specific positions if you like, but I think those positions have basically been on there since the start. I just haven't asked for permission for them until now.
Okay. Any questions from my colleagues? And remind me, I think it was in the document, but I forget. So how many total FTE will you have after this?
When this is all done, there'll be 41 FTE, including me.
Okay. And that's going to be the status quo for, unless new needs come in. But that's your baseline right now.
Right, pending addition of other programs or new funding. We did talk when we decided what services to provide that we might want to look into pools in the near future. I'm not sure that requires any more staffing, but things like that might come up if the community is asking for some service and the Board of Health decides, yes, we need the service, then there may be a need for more staff. But as of right now, what you've told me you want me to do, this should be enough people to do it.
Okay. Yes.
So just a question around the health educator. I'd heard you talk about the tobacco initiative, but are there other, can you just clarify?
So right now, 2 of those health educators are for the expected tobacco funding. The third one I want to be a little bit more broad and general, and it's to get involved in things like suicide prevention, where we can get a toehold in that space, work on senior fall prevention, work on, diabetes education, all these myriad of health conditions that were important to the community when the community health assessment was done. It's to start to respond to those. And the rest of the response is going to be Laura and I being on all kinds of committees and coalitions, and I'm involved with the mental health initiative and suicide prevention and homelessness already. But so the health department is going to be involved, but I'm not proposing to add positions until I find out if there's a need. Because some things are well in hand, and I don't need to go in and say I'm the new guy in town taking over.
Councilman.
In the point, so if there are grants available, those will not be Douglas County hired. Those will be kind of subcontracted for, like for example, the WIC. Those will be subcontracted because it would be just a grant that would pay for that service, correct?
Well,
in future state.
They'll be county employees.
They will.
I mean, if we got a really short-term grant that says we'll give you money for 6 months to do project A, that probably would be a contractor because it wouldn't make sense to hire an employee. But the WIC grant has been going on since, I believe, 1983. So I don't have any fears that's going away soon. So we might as well give people stable employment and get dedicated employees in there.
Okay. Yeah.
Well, and obviously their employment's tied to the grant being renewed as well. So
I mean, all of us
Right.
serve at the pleasure of the Board of Health.
Right.
And if there's not enough money to please the Board of Health to have us here, then we go away. And I think we all understand that.
Right. Okay. Any other questions? Let's go to public comment. Is there anybody in the room who has a public comment? Do we have any comment online? Ms. Dunning?
Thank you. I have no online comment.
Wonderful. Okay. So this is the point where I would take a motion. Oh, I see what you're. Okay, so I'll take a motion to approve or deny a request to fill remaining positions for Douglas County Health Department.
So move.
Do I have?
Are you making the motion? Or
No.
requesting a motion?
Okay, so I will make a motion to approve a request to fill remaining positions. Do I have a second?
Second.
Okay. With that then, all in favor, say aye. Aye. Opposed? Great. So let's then move to citizen comments. Are there any citizen comments in the room? We have 2. Mr. Fielding, if you would give us your name and the town you live in, that would be great. And then, ma'am, you will be next.
John Fielding, Pinery. I would caution this board against being premature in declaring the pandemic over. If you read the Denver Post, they're currently talking based on alleged data from Australia that we're going to have an early and severe flu season. And we know that the general editorial slant of many of these large mainstream media companies is not in favor of this board. And I would not like to see this board squander credibility with the public by prematurely declaring the pandemic over and then getting caught when it turns out that the flu season, in fact, is more severe. And then the reporters, because they blame this county for the demise of Tri-County Health, would say this board is somehow incompetent, dishonest, or otherwise would try to erode this board's credibility with the public. So I would caution not to be premature in declaring the pandemic over.
Thank you, Mr. Fielding. And if you just give us your name and town you live in, we'd appreciate it. Thank you.
Good afternoon, Board. My name is Fran Santagata, and I live in the Roxborough community here in Douglas County. Have been a resident here for 17 years, and I'm really excited to be able to start attending these meetings. I'm newly retired, and it's great to see Mr. Benevento leading the charge here. I've kind of followed you around the government agencies. I just recently retired from the Department of Homeland Security. I was at CISA. And before that, I was at the state and was at the state while you were there, which was very comforting for me to see you take on the lead role here. So it's exciting for me to see, I've been trying to follow virtually online the build out of the department, and Mr. Hill has done a fabulous job hiring some very, very competent folks. I was extremely excited to see Mr. Sherback here because I've worked with him for many years. And, you know, I think your comments earlier, Mr. Benevento, about doing an after action, that is such a great idea. What I would add to that is please look at the public's response to this, right? A 360 look in the after action. Because I think, you know, as somebody who did community preparedness at the state level, and I was also here as the Director of Emergency Management at Douglas County, what I've seen often is where we fall through is the citizens' reaction to what we want them to do. And oftentimes that education needs to be done in advance. We were way behind the curve on that. And our expectations and our frustrations when people were reluctant to do what we asked them to do really speak to breaking that communication, and it's critical. I think there were a lot of lessons learned from the pandemic to help us be better prepared for that. And I'm seeing the same thing happening with wildfire response. It makes me sick to my stomach to see people saying, well, we didn't know we had to sign up for reverse notifications. Really? We've known about that for more than a decade. I was here in 2010, and we had that in place, and we went around after every wildfire and got people to sign up. But we've lost that. The public's memory of what they need to do to keep themselves safe just goes out the window. They're on to the next thing that's in the news cycle. So I would really, really encourage you to look at where we did well and where we have room for improvement on that, because as great as the department is, if we don't address that issue, our response could turn to look out to be terrible, because people aren't doing what we are hoping that they would do. And with that, I just would like to thank you for the opportunity to speak to folks, and I'm just really excited to have the opportunity as a citizen of Douglas County to come and listen to what's happening, because it really makes me excited to hear all the great things that are happening here. And Mr. Hill, we're very lucky to have you here leading the charge. So thank you. Real quick, if you if you have the time in the desire to do this, it would be great if you were to send an email send it to me, send it to Michael, sort of building out that public response piece, because I think you're right. I hadn't, to be honest, I hadn't thought about that. And so I think that would be valuable. I think it would be good for us as we're sort of scoping this out to have your input into that. So if you have time and you have desire, if you would send it to Michael, send it to me, send it to both of us on our county email, that would be really helpful. Yeah, absolutely, because we know this isn't the last time we're going to have a pandemic. And when I was here at Douglas County, we had the H1N1 response, and we had pods set up. Gigantic pods. We did it through the school system and did it that way. We were lucky that did not have the death rate that COVID had, and we're able to get folks vaccinated pretty quickly and move on. This was a whole different scenario, and I'm a med tech by background and an exercise physiologist. I have a BS and an MS, And this fear I had back in 1972. This is not new. We are we are seeing these evolving pathogens that over time are going to start to pop. So capturing those lessons learned at this point is really, really important. So thank you for your foresight.
Yep, no, thank you for your comments. I appreciate it. Ms. Dunning, do we have any online comments?
Thank you, Mr. President. We have no online comments.
Wonderful. So I think then at this point, I would take a motion to adjourn.
I make a motion to adjourn.
Do I have a second?
A second.
All right, all in favor, say aye. 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 All right, thanks a lot, y'all. Good to see you.